Oh, yeah, yeah.
Karen, it's so lovely to speak to you today for She Can. Tell us a little about yourself and what you do.
Okay, well, thank you for inviting me to have a chat with you, Steffi. So I'm Karen Hynes, and my background is in nursing. Um, a long time ago, I undertook a fabulous degree in nursing, adult nursing actually. And what was quite good about that is you could then specialize in your final year, which was the fourth year. And I decided to become a registered health visitor as well. I think at the time I was drawn to working in the community more than the hospital setting. And I was probably drawn to working with, yeah, very much so drawn to working with children and families. So I was at the University of Liverpool, and I really did have a fantastic grounding in my nursing career. All these years on, not giving my age away, I am still in community public health nursing. Health visitors and school nurses are sometimes perhaps slightly mysterious people to the public, probably seen as working with children, of course, but it's a much wider remit than that. It's all about public health nursing, and it is actually a specialist community public health nursing qualification that we have. So I guess the passion there really is around public health, and thinking of creative ways, if you like, to really ensure children have the best start in life. That's a bit of a corny catchphrase because that's what current government policy is all about. But it is about equality, social justice, fairness, and really trying to get the help in early in a proactive and meaningful way for families to ensure that their children do well, which is what all families want.
Amazing, Karen. I know that you teach as well at the moment, don't you?
So
Tell us a bit.
absolutely. So thank you. So now I'm involved in teaching, and I am teaching community staff nurses actually who are working in health visiting and school nursing teams. And they've got a very important role in helping health visitors and school nurses, which unfortunately has become quite a scarce resource to work and do that really important early work. It is very preventative with children. In fact, they work with families, health visitors and school nurses and community nurses, nursery nurses as well. It's a really multidisciplinary approach, actually. They work with families from pregnancy right through to 19 years. So it's a very kind of comprehensive, holistic approach to supporting families. I was actually taught, it's an interesting expression, cradle to grave. So when I learned to become a health visitor, we also worked with the elderly, which was fantastic. So it does really give you that kind of life course understanding, which underpins that public health model of today.
Beautiful. I think you said that so well. Karen, you told us a lot about the journey of how you got there. How was your road to now teaching and being a little bit on the on the other side? I can imagine
Yeah.
there must have been many experiences that were both beautiful, but also many different emotions coming up on a daily basis. How do you deal with that?
Yeah. So I think, truthfully, working I was probably a very young health visitor working in Wandsworth many years ago. Probably felt, yeah, pretty overwhelmed at times because I went straight from my degree into this specialist role, and there's an awful lot of responsibility and indeed autonomy that goes with that. I think the thing that kept me going was the not only my colleagues. We are a pretty supportive bunch, and the word resilience comes up a lot. Well, you see this all around you in your working practice. Um, and so you draw on those people you see as role models, be it may well be a more senior member of staff, but it also may be a colleague who they're just those fantastic leaders. They kind of, it's oozing out of them, isn't it? That fantastic leadership leadership qualities and resilience. And I think you draw on those people, but also very importantly, the families themselves. They they keep you connected. Um, you build these relationships with these families, and that is really important. So there's no shortage of drive in that sense, because this is the work that we do. And I think if you kind of, if you look forward to visiting somebody that day and connecting on a human level, on a compassionate level, then you're hooked. Um, and other people I know will have other skills, multitude of skills, but for me, I think it's that connecting. And so in teaching, I went from sort of, being a health visitor to a community development health visitor, which was a fantastic post, and then moved on to a safeguarding role, which was challenging, but you start to understand even more the need to work with other sectors, other agencies, and indeed the voluntary sector, who are often the unsung heroes with incredibly specialized skills as well. And right now, that's what I probably enjoy most, is working with many different colleagues from across the health and social care sector in teaching, and again, drawing on some very wise owls around me, who support me. And yeah, I draw off people, I guess, who have the most amazing leadership qualities.
Amazing, Karen. I love listening to you. Um, Karen, what is your motivation every morning to get back out there? I know it's the relationship with people. Where do you think, when did you realize in your life that this is what keeps you going? This is
Well,
what
okay,
work.
yeah, it's a really good question, because sometimes can feel very stressed and overwhelmed, and perhaps feeling on the wrong side of where you feel you should be. And I sometimes have tried having a bit of a quieter time, and then I will be often driving along listening to a radio program or something, and I can start to feel this fire in my belly, and you're sort of thinking, got to get back out there. So I guess it's a sense of calling, mixed with frustration, if you want to try and put things right. Nurses are great problem solvers, and we naturally, I think, are drawn to working with others to create some pretty interesting solutions. So you might be listening to something that really bothers you. It could be around lack of support with mental health issues in the perinatal period. It could be around breastfeeding. It could be around supporting children in schools and mental health approaches. It's so much, and you just think, and then it's like a trigger, and you think, well, I need to get back out and do that. And yeah, I'm getting restless. So I tend
Amazing,
to go back into it.
amazing, Karen. So I wonder, it sounds like you have to have so many different areas covered, psychological, physical, etc. How much training do you get? How much psychological training is there to equip you to do that?
Well, that's a really interesting question. I think that's probably a very important part and parcel of this whole need to remain both resilient and keep the passion alive, is that it is ongoing. It's endless, and we have to update ourselves all the time. And as a nurse, there is a very clear um, continuing professional development program, way of revalidating our skills and updating ourselves. But it's in terms of continuing professional development as well. We come together in a number of ways, different forums, specialist fields. And going back to your question, is that yes, nurses, and I'm speaking, of course, about public health nursing here, have a very broad range, depth of knowledge. That's for sure. So the updating is constant. But in addition, you'll find always that some of my colleagues, both when I was working in practice and indeed in teaching, are drawn to certain areas within that across that sort of range of knowledge that we all must have. And so that might be around a really exciting field. It may be around mental health, promoting infant and perinatal mental health, supporting parents, couples, couple relationship. There's a number of so much, and yeah, of course, people have their, if you like, I guess, their kind of areas that they're drawn a little more to, but they need to be able to cover a range of issues and respond. And I think it's about just saying, you know what, I'm not sure, but I'm certainly going to find someone that can help you here, or look into this and look at the resources, because you find increasingly that the way to best obviously support people is to really draw on a whole range of resources, and what works for one person may not work for another. It needs to be, I say, bespoke. I think the
Tailored,
term now is person
tailored.
centered.
Yeah, yeah.
Yeah.
Amazing, Karen. God, how much respect I have for a newfound respect for that area.
Mm.
Karen, what would you say are your strengths? Why are you so good at what you do? What is your superpower?
Well, I think I'd have to ask my students, who probably come up with a whole, they're very good. They always have their strengths and areas for improvement. We have these conversations all the time, which is healthy. I think it's about being curious, about wanting to continually improve. Um, I think that is the strength, actually, uh, engaging in those um, kind of, it's the self-awareness, but also the questioning and critical awareness that you need to just keep questioning, keep allowing yourself to continually say, oh, I give myself permission to change my mind, because guess what, someone's just enlightened me and I really didn't know about that. And that is so important. It's incredibly important in terms of human and social justice, and just being willing to go, oh, I got that wrong, thank you, you've really helped me today.
I'm
So
so
I think that's the superpower.
I'm so happy you say that, because it's such a mindful and thoughtful way of going about it. And I think that is an inspiration for all areas, actually. Karen, what are your top tips for other women?
Well, I think sorry, there's a little bit of background noise. I increasingly am seeing these different ways of women coming together, and being very powerful through social media, and to connect right across into different worlds, be it business, be it care, um, be it environment, and so on. It's we're able to connect on so many ways. So I think if the opportunity arises, then go for it. And just like today, you're giving me and many other women an opportunity to be able to share their stories, very important, and to connect in ways that we probably couldn't have done before, and just to sort of look after each other, stick up for one another. It's so important, because we're obviously amazing.
You obviously say everything that I love to hear, which is why we were doing She Can. Karen, my last question would be, where do you see yourself in the future, sort of in 5 years' time? What is your dream of where would like to get to?
I think I have for some time probably lacked the confidence, if I'm honest, to get writing, to publish something, and it's about doing that in partnership with colleagues, with students. They're the experts, and with the people, most importantly, that use our services and are helping us to improve aspects of care. So I would like to be writing. It's something I think I've put to one side a bit too long. And being in academia, it's something that many of my colleagues do very well. That's what I'd like to be doing in 5 years. Try and share some some knowledge to develop, to continually contribute to this ever um, evolving knowledge base.
That's so exciting, Karen. I can't wait for this to come out. I think it's such an important thing to share. You have so much wisdom. Your colleagues and students will have so much wisdom, and it really needs to be made more public. You know what an important role all of you play in our society of today, and even more prevalent since COVID and the times we live in
Mm.
right now. So I'm so thankful you spoke to me today, Karen. Thank you so much.
Thank you, Steffi.